In this video, Gail and Lloyd discusses the assessment of the translation of the thoracic segment.
We have left translation, okay, through the whole of the thorax. Okay, so right rotation, left translation. On our segment that's involved, what we're going to do is we want to get on the transverse process. You can use like this, or this, or this, whatever your handhold is. So we're going to get on the segment. He's just being a little helpful to me. I'm just going to be on the transverse process. And I just want to actually see if he has ability to translate. Okay. Let's get another segment. Okay. If you're little, then it's easier to pull than it is to push. So just come to the other side. So pull, switch sides, pull. Does that make sense? So you don't have to do push and pull. You know, I got good control of him. But I'm bigger than some of you girls. So just make sure you're assessing what you think you're assessing. So does he have the ability to lateral translate? I'd have you trained in like 2 weeks if you were with me. At least while you're in PT. Okay. Stability. If we want to know if we have stability of that ring, now we're going to go from the transverse process and we're going to get a wide grip of the whole ring. So this segment, say we're on T5, we are getting hold of the 6th rib. So the 6th rib is coming into the inferior aspect of the T5 vertebra and the superior aspect of the T6 vertebra as a ring. So we're going to get a hold of the 6th ribs and we're going to squeeze these 6 ribs together. And what we should be essentially doing is gaining stability. And now we shouldn't have any translation. Okay, that's my test right there. You don't see anything? Because that's what we want. Let's go up one segment. Stability, stability. Okay, and you need to be assessed for your stability. Okay, so that one segment that we looked at last night, we don't know if he has instability at that level. Alright, and a couple of you might have to be checked for stability. So now we're getting into some of those, we looked at those earlier stress tests, say they were negative, and now that one patient that has sharp pain at certain movements, but we can't find it, or our quadrants look inconsistent. Now we might look at this as a stability factor to see if they have this excessive lateral translation. So he does not. So that's what you want to do beforehand. So again, let's go over it one more time. Segment, mobility on the transverse process. Do we have translation? We have to have translation both ways. If something is stiff, we won't have translation. If a segment is subluxed, like that Dianelli's lateral translation subluxation, we won't have, what you'll have is mobility one direction and not the other direction. We come in, we stabilize, pull, pull, should be nice and stable. Okay, and that's how those rings should be. Alright, let's do that.